I am Jenny Keeley, and I'm the Program Director for the University of Missouri Respiratory Therapy Program. Respiratory therapy is a profession that is rooted in bedside care with a focus on assessing and treating disorders of the lungs. The majority of respiratory therapists work in the hospital. We work in the acute care setting, meaning we're working with patients they're still sick. We also do work with patients who are on the rehabilitative side. Perhaps whatever got them in the hospital, maybe that has resolved, but they're having a difficult time weaning from the ventilator. So we might work in more of a rehabilitative side, a weaning hospital. There are respiratory therapists who work more on the administrative side. We have respiratory therapists who work in home care, in pulmonary function labs, in sleep labs. And we have RTs in research, so not as many as we'd like. We need more. This is one of our simulation labs. They're quite simple. So this lab, and we have another one that's identical next door, get heavy use because the students will learn something in the classroom and then they'll come over to the sim lab and practice using the equipment that they learned about that week. You're in clinical from the first week of your junior year. And usually in that first week, it's all about just learning how to be a clinician in the hospital, wearing those scrubs, going in, introducing yourself to people that you've never met before. Our students are in clinical almost 1,100 hours by the time they graduate, which is on the high end of a lot of clinical programs, which makes them highly valued by employers because they are workforce ready. I have students who come in who they're not really sure what they want to do, but they think that they want to be in healthcare, and respiratory therapy seemed like a good thing to try. People, I think, tend to zoom in on just what they've heard about, but you don't hear as much about speech and respiratory therapy. And so if there's an exploratory class that's offered at your high school, take that exploratory class and find out what other kinds of health professions there are out there. And then when you come here to Mizzou, if you take the Health Sciences 1000 class, you get to hear from health professionals of all different kinds, and you get a better idea of just what's out there, because there's a lot.